So my name is Tyler Southwell. I'm a family medicine doctor and I've been practicing here in the Valley since 2012. I've myself been living with chronic low back pain for a long time, and I actually tried a topical CBD product very skeptically and an oral when I had a flare-up on Christmas Eve a couple years ago, and it relieved the pain with no side effects, which is not something I've ever experienced. I don't do well with narcotic pain medicine, and ibuprofen never really cuts it, so I don't usually even try it for my back pain. So I was very, very excited about that. Medical marijuana I certify some patients for when I think that they have a qualifying condition, but that's not a big part of my practice. But CBD is something that I talk to patients about almost every day, because in my practice, if I see 25 patients, at least 4 or 5 of them are there to see me with something related to chronic pain, and I find it works so well for pain, I use it for that. And then also I will talk to patients who have anxiety or sleep problems about it, and then for my diabetic patients who aren't under control on their current medication regimen, I talk to them about it too, because I find that that's very effective to improve their sugar control. No, you don't need any kind of special permission to have CBD as long as it's produced through a company that follows federal statutes. It's a hemp-based industrial hemp product if it's done right, and that doesn't require any special permission. CBD works on receptors, the CBD receptors in the body that we all have. CBD is actually a natural product of the body as well, so all of us have some CBD action going on. When you take additional CBD, you're pushing harder on those receptors throughout the body. How it works is very complicated. There's a lot of research on it, but how it feels to patients and how it, the best way to look at it is it deadens pain fibers. It makes pain less. If you put it topically on a joint, it has anti-inflammatory properties as well. Studies show it decreases inflammation in that joint, and then if you look at the stimulation of the spinal cord and the brain, there's decreased pain transmitters. So it definitely has a relationship with the nervous system and does other things that are beneficial in pain. Opiates are great pain medications. We don't have a ton in our arsenal when we're treating pain. We have anti-inflammatories, and then we have opiates pretty much. So if someone's in severe pain that you easily understand, they broke a bone, they were in a severe car accident, they have herniated disc in their back, and you can say that's exactly what this is. Generally, you're going to try to give them a little anti-inflammatory, but you're going to give them opiates in that encounter. Opiates are also great medicine for pain. They have a really bad rap because they have all these side effects. They can kill you. If you take too much, they can drive down your drive to breathe. If you combine them with alcohol or you combine them with sedatives, that's compounded. So they kill people every year through misuse. Most of those people are not addicts. They're just chasing pain with no education on how dangerous these medications are. Although I do think that's becoming more popular. Everybody who takes opiates pretty much gets constipation. People can have personality change. They can get angry unexpectedly. They can improve quality of life if pain is ruining quality of life. But a lot of my patients who have chronic pain eventually try to get off opiates because there's a stigma to taking them. They're very hard to get from your doctor. Every doctor you go to doesn't know you, treats you like you're seeking to get your fix because you're an addict. But also there's all these side effects to taking them. So a lot of my patients with chronic pain just cope until they come see me and I try CBD on them, and frequently that helps the situation. Studies show that if you're taking an opiate and you add CBD oral to the mix or systemic CBD, it increases the efficacy of the opiate without increasing the severity of its side effect profile. And so my patients on CBD who are chronic pain patients, they are taking less and less opiates, which is great in the current environment where doctors are being so heavily scrutinized for their prescribing patterns with opiates. But even if it wasn't for that, why would you want to use something that has almost no side effect profile, Very little, if any. I don't think I've ever had a patient call me and say CBD ruined my day. And then, you can take less opiates or no opiates. I have several patients who are off of opiates thanks to CBD. I mean, so you have to look at what you're treating. If the pain that you're treating is global, multiple joints like rheumatoid arthritis, you're going to need something that's going everywhere, so you need to take a systemic product. There's capsules. Downside of capsules, in my opinion, is that they don't start to release until they hit the gut, and the gut, every bit of blood that gets the CBD in it goes right through the liver. It's a primary place that CBD is processed, so on the other side of the liver, you have a lot less CBD than you took. If you take it in a tincture form where you can hold it under your mouth, under your tongue, and around the surfaces in your mouth, you actually absorb it in a way that gets around that metabolism, and I think that's important. And then you need to swallow the dose too, so some of it is still going to go through the liver, but more of it's going to go systemic than if you just swallowed a capsule. And then people vape it. I don't know good research on vaping it. I think it works, but I also am very nervous about the propellant and the liquid that it's dissolved in. So I'm not really sure I can recommend that. Also, I'm not sure how to dose that. The dosing through tinctures is something that's easy to titrate for a patient. You can start at a small dose or a large dose and come down to a small dose. You want to get to the lowest effective dose. But then sometimes topicals really work. So for my sciatica, for example, I never expected a topical product to be able to help me as much as it did, because the structures I'm trying to get to are deep. I have a herniated disc history. But the newest research on pain with sciatica and nerve pain is that some of that pain is actually in the musculature that's fed by those nerves. So on the other hand, I can see how it would help, because I put it along the distribution of pain, and within, I would say, less than 30 minutes, the pain is significantly reduced by using the topical. My patients with trigeminal neuralgia, which is a facial pain disorder, feels like a blowtorch sometimes that's on your face. Those patients are on heavy-duty nerve deadening medications, but I've had several use the topical and the tincture together and get off of everything else. So it works extremely well for nerve-related pain, which is pretty much all pain. There could be. So I gave a patient once CBD for pain. She also had Parkinson's disease. She, without talking to me, found out that it helped her tremor. She started taking it on a schedule and having hypoglycemic events. She's an insulin-dependent diabetic, so she was taking insulin at a dose of 35 units of long-acting a day, and she was getting blood sugars below 80 every day. Didn't call me. I called her to ask her how she was doing, and that's what we found out. And I couldn't figure out what changed. Nothing changed in her diet or her meds, but what happened is that she was on CBD. There are studies that show CBD improves A1C or fasting blood sugars in diabetics. I read that research, but I was more focused on pain when I started using this in my practice. And then I realized what this could do. So this same patient now on just 30 milligrams a day of CBD is off of long-acting insulin altogether. She does not need it for glucose control. That was shocking to me. So now since then, the last year, I've used it 15 to 30 milligrams a day. It's a very low dose, and that seems to help sugars immensely. So I'm keeping more patients off of insulin. I'm taking patients on moderate to low doses of insulin. Some of them are able to get off using CBD, which is just incredible. I mean, have another tool in your toolbox for diabetes management is amazing. Okay, so topicals, you have to think about what the topical's doing. So it's going to decrease inflammation, so you want to put it right where it hurts, but you also have to think about the anatomy, the nerve anatomy of the area. So if it's sciatica, the origin of the nerve is the spine, obviously. You want to cross the midline when you're rubbing this stuff in, just so you get the maximum chance of you penetrating somewhere near the pain origin. And then the pain goes down the distribution of the nerve, and if you have sciatica, you know what I'm talking about. It goes down, right where it goes down your leg. You have to rub it all along that nerve distribution, because the muscles that it affects are part of the pain generation, and the muscles will be relaxed through the interference that the CBD brings, and the nerve itself in those areas will stop transmitting. In fact, you'll find with CBD, it's a good product. You'll feel like your skin is a little numb after 30 minutes or so where you put it. I encourage patients to rub it in for 2 to 5 minutes. That's a long time if you're actually using a timer. You got to really rub the product in because it's oil-based, and the heat of rubbing it in helps it melt and helps it penetrate. I'm really confident of that. But yeah, so you want to start with the origin where the nerves are coming from and go all over where you feel like the pain is. If it's a knee, you want to do the front and the back of the knee and a little bit above the knee, and you want to do it over days. So the other thing is that this will build up in the tissues. So if you do it, if your pain is severe, you can do it 3 times a day for 3 or 4 days. You're going to get a lot more out of that than if you just try it once and walk away. It didn't work that well. It will work better and better, and then you can maintain it with a twice-a-day application, generally. It doesn't always work, especially for joints, big joints like a knee, but sometimes it really helps, and it's obviously a lot safer. It doesn't cause ulcers like Celebrex or Advil. It doesn't cause kidney failure. It doesn't cause liver problems like Tylenol. And obviously it doesn't cause any of the problems that opiates do. So the sublingual tincture, you want to find a product that doesn't taste terrible, because the longer you hold it in your mouth, the better you're going to get out of it. So if you can hold it under your tongue and you can swish it around your mouth, get it on your cheeks, get it all over in there, because every surface in your mouth is a great surface to absorb this product. It's a lipophilic product, which means it crosses through cell membranes relatively easily. So it's going to come in that way. What I tell people to do is do that for up to 2 minutes, and if you can't stand it anymore, you got to swallow it. Just go ahead and swallow it. And when you're using it, to think about how to dose it, I tell patients if their pain is bad, I tell them to start up to maybe 90 milligrams. And then if that works, the way you judge if it's working for you is it needs to last longer than 2 hours, and it needs to give you significant relief. So you're looking to dose it not only for percent of improvement of your pain, but how long does it last? If it gets you 50% better but only lasts 2 hours, I would take the dose up 50%, because then you're going to get maybe 4 hours. But if you take it even higher, you might get 6 hours. And there is really no dose that's easy to get in the world anyway that could ever cause a side effect. We use it at 1,500 milligrams a day in children with seizures, and these kids develop normally and go to school and they don't act like kids who are on seizure meds even, really. So if you think about that, I mean, an adult person can probably have 3,000 a day, and that is not a dose you'll find on by any supplier, because that's very expensive. The doses I find to be effective, little as 15 milligrams. Some patients are on 200 milligrams, but that's a really rare exception. I think that there's a variation in the population on how fast people can process this. And so you won't know your dose until you are guided through it by a physician, or you read enough that you can figure out your own dose. I think everyone can actually figure out their own dose without a doctor, but having a doctor help you with that is important, I think, too. So if a patient comes to me and they're in pain, that's 6 to 7 out of 10. That's pretty severe pain in my opinion. If they're in my clinic, I'm going to go ahead and give them a dose of probably around 100 milligrams. Because I want to know, is this medicine going to work at a hefty dose? And I have them sit with me for 20 minutes or 30 minutes. And if they start to feel relief, I feel good about proceeding with them buying the product and investing in it. Because good CBD is not necessarily cheap. So if they buy it at that point, I tell them next time, why don't you try half this dose and see if it works for you. If that works, I have them half it again. I want them to get to the lowest possible effective dose, the effect being pain relief and duration of action that's acceptable to them. Because it's expensive, and you want to always take the least amount of anything that you can to get the effect you're looking for. But if you can get effect off a lower dose, it's also going to last you a lot longer when you're investing in CBD. Well, I mentioned earlier the lady with trigeminal neuralgia. I've also had patients with panic disorder, which isn't something I really touched on, but patients who believe that they need Xanax every day, I've had a success with those patients as well. So there was a patient I'm thinking of now. It's a concierge patient of mine. We were waiting in a surgeon's office to see him, and she was having a full-blown panic attack. I gave her CBD that we hadn't really discussed to that point, but I had some in my doctor bag, and I gave her a dose of 30 milligrams, and I watched her like de-escalate in the next 20 minutes. And by the time she got to meet the doctor, she had herself composed, which was really important because we were going to discuss important things that day. that would cause panic in a lot of people. And what's interesting about CBD in that setting is that it doesn't cause sedation. So you can get in your car and drive after it. You can take it while you drive, for all I care. It does not make you psychomotor slowed. It doesn't ruin your coordination, your reaction speed. It doesn't make you want to sleep, which is just an amazing benefit. Now, I will say it doesn't work for everybody with panic disorder. Some people really need Xanax. But you might as well try something that's safer first. And so that's something that I think about as a pretty amazing teaching moment to me for CBD. But I have a litany of other stories if you want more.
Hey, I really appreciate your time today, and thank you so much for sharing a little bit of insight with our members.